Okay. Today I'll tell you about the bony features and attachments of femur. So first of all, we'll discuss the side determination of femur. This is the upper end of the femur having this rounded spherical head, this constricted neck, and the two trochanters, the greater trochanter and the lesser trochanter. And this is the lower end of femur that has the two condyles. These condyles are connected in the front, and posteriorly they are separated by a notch that is called the intercondylar notch. And on the posterior border we have linea aspera, that is a sharp border. This is lying posteriorly. So anatomically this is the bone of the right side. Now I'll tell you about the bony features of this bone. First of all, let's discuss the upper end of the bone. This rounded part is the head of the femur. It has fovea, this pit in the center of the head that is called the fovea capitis. It has attachment of the round ligament of femur or the ligamentum teres. This is the constricted neck. These are the two trochanters, the greater trochanter and the lesser trochanter. The two trochanters are connected in front by an intertrochanteric line, and posteriorly they are connected by an intertrochanteric crest. Now coming to the lower end, on the lower end we have the two condyles. This is the medial condyle, this is the lateral condyle, and the two condyles have their corresponding epicondyles here, and these are the supracondylar ridges, the lateral supracondylar ridge and the medial supracondylar ridge, and this is the intercondylar notch. Now coming to the shaft of femur, the anterior border of shaft is rounded and smooth, and the posterior border has a sharp edge that is called the linea aspera. This linea aspera is diverted inferiorly and superiorly. This is connected with the lateral supracondylar line, and this edge is connected with the medial supracondylar line. And this, on the posterior surface we have a tuberosity that is called the gluteal tuberosity. The linea aspera has two lips. One is the lateral lip of linea aspera, and this is the medial lip of linea aspera. The medial lip continues with the medial supracondylar line, and the lateral lip continues with the lateral supracondylar line. And these two lips are bordering this area, this triangular flattened area that is called the popliteal surface. On the medial epicondyle, there is a tubercle that is called the adductor tubercle, which gives attachment to adductor magnus muscle. Now I'll tell you about the attachments on various parts of this bone, which is the femur. First of all, let's come to the upper end of femur. So the attachments on this greater trochanter are, on the anterior surface of greater trochanter we have attachment of gluteus minimus. On the lateral surface of greater trochanter we have attachment of gluteus medius. On the apex of greater trochanter there is attachment of piriformis muscle, and then on the posterior surface we have attachment of three muscles, the two gemelli, gemellus superior, gemellus inferior, and the obturator internus. And on the medial surface there is a fossa that is called the trochanteric fossa, which gives attachment to the obturator externus muscle. Then coming to the intertrochanteric line, the upper end of intertrochanteric line gives attachment to vastus lateralis muscle, and the lower end of the intertrochanteric line gives attachment to vastus medialis muscle. Then coming on the posterior side, this is the intertrochanteric crest, which has a quadrate tubercle giving attachment to the quadratus femoris muscle. Now the lesser trochanter gives attachment to psoas major muscle. Just inferior to the attachment of psoas major we have attachment of iliacus muscle, and following this there is a line called the pectineal line, which gives attachment to the pectineus muscle. Now we'll trace the two vasti posteriorly. This vastus lateralis that is attached on the upper end of the intertrochanteric line comes back on the lateral surface of the greater trochanter. Then it passes along the lateral border of the gluteal tuberosity, comes down on the lateral lip of linea aspera, and till here it is attached. So this is vastus lateralis on the lateral lip of linea aspera. Now let's trace vastus medialis. Vastus medialis is originated from the lower part of the intertrochanteric line, goes back on the spiral line, and then comes down on the medial lip of linea aspera, and it is attached here. So we are done with the two vasti, the lateralis and the medialis. Vastus intermedius is attached on the anterolateral surface of the upper 2/3 of the shaft of femur. This is the attachment of vastus intermedius muscle. Just below it is attachment of the articularis genu muscle, and on this is the popliteus muscle here in the popliteal fossa. Now coming to the posterior side of the shaft of femur, we lateral to the attachment of the vastus medialis, we have attachment of adductor brevis muscle. Adductor brevis is just located just below the pectineus muscle. So between adductor brevis and vastus medialis, we have attachment of the elongated adductor longus muscle that comes on the medial lip of linea aspera. Then there is attachment of the adductor magnus muscle. It comes from the medial border of the gluteal tuberosity, comes down on the medial lip of linea aspera, and then it comes down on the medial supracondylar line, and finally it is attached on the adductor tubercle. Then coming on this popliteal surface, on the lateral supracondylar line we have attachment of plantaris and the lateral head of gastrocnemius muscle, and on the medial surface of this popliteal surface we have attachment of medial lip of gastrocnemius muscle. Then on the lateral lip of linea aspera we have attachment of biceps femoris muscle.